This week's Ask Dr. Durie comes from a patient who wants to know, how soon will new immune therapies become mainstream? Well, the answer is that some already are. We do have FDA approval for Daratumumab, which is a monoclonal antibody against CD38, and Elotuzumab, which is a monoclonal antibody against SLAMF7, another important surface antigen. And so we already have evidence that these kinds of immune therapies can have an impact and are quite important and are entering the mainstream. I would say that the evidence is particularly strong for the Daratumumab, the anti-CD38. The combinations of Daratumumab with Revlimid, with Veclade, and with pomalidomide, each one of those combinations combined with dexamethasone are already approved by the FDA. And in fact, these combinations are particularly impressive since, for example, the Daratumumab, Revlimid, and Dex has produced a significant amount of MRD negativity in patients in the first relapse setting, so that patients who have relapsed from their initial therapy can have a really deep response with the combinations including Daratumumab. And so clearly already a strong mainstream presence for these kinds of immune therapies. But the question really is, and I sense this from the questioner, what about the other immune therapies that we're hearing about so much in the news these days? And there are several of those. And so recently there has been in the news discussion about the checkpoint inhibitors. And these are inhibitors which block the immune system and allow the T cells to attack the myeloma. However, recently in the news was the fact that some of those coming from the Merck company, an agent called Keytruda, was actually interfering with the normal immune system and was causing more side effects and problems in combination with Revlimid and pomalidomide. And so there is some concern that although checkpoint inhibitors can work well in myeloma, there may be some unexpected side effects. So we need to be cautious about that. Another type of immune therapy is bispecific antibodies, antibodies which link one cell with another to bring the immune cell up with the myeloma cell and make the targeting and destruction of the myeloma more likely. Well, recently a bispecific antibody was approved by the FDA for leukemia. And so there is some encouragement that bispecific antibodies may be approved relatively soon. But perhaps the most hope, and I would say a little bit of hype, has surrounded the CAR T cells. On Wednesday, this past week, in fact, there was an approval for CAR T cells in the treatment of acute leukemia in children. And this means that the CAR T cells, which are engineered T cells from the patient has the T cells taken from the blood, they are processed, engineered to attack the cancer, grown up in a large batch, and given back to the patient. Those CAR T cell batches are designed to attack the cancer. Now, in this case, the case of approval by the ODAC committee for acute leukemia, this went very smoothly. For upcoming approvals related to myeloma, where the antibody is against the surface antigen called BCMA, B-cell maturation antigen, the data are not so clear, both in terms of the benefit and the side effects. There are side effects which include something called a cytokine storm, which is where there can be swelling, including in the brain, which can be quite dangerous. And so the bottom line for CAR T cells is that we've seen some pretty remarkable benefit with deep responses, but some of the side effects and toxicities are still an important concern. And so bottom line in this case, a lot of interest in immune therapies, a couple of immune therapies already approved. Which will be the next ones to move forward? A little hard to say, but it is pretty clear that there will be an ongoing and increasing impact of immune therapies in the management of myeloma moving forward.